I feel it's important to bring awareness to breast implant illness for two different reasons. One is to act as a guide for those who are already identified that breast implant illness is an issue for them. And secondly, really to bring awareness to the topic and issue and concerns that we have about breast implant illness for someone who's seen multiple doctors and have not been able to find any solutions. Common breast implant illness symptoms are several and vary, but the most common symptoms that we see in our research today are fatigue, dry eyes, tingling in arms and legs, shortness of breath, difficulty focusing, memory issues, and autoimmune diseases that they've been diagnosed with, either a thyroid, Hashimoto's or Graves' disease, rheumatoid arthritis, or lupus, ankylosing spondylitis. And so if we have these conditions, it may be related to breast implant illness. And we have a longer list on our website at eastvalleynd.com where you can see 30 different symptoms that other women who have had BII have made note of them. There are 4 different theories or concepts as to how breast implant illness can occur at this point in time. And hopefully research will continue to take place so we have more information to pull from to help patients. But one of the theories or concepts is that implants, unfortunately, both the saline and silicone implants have heavy metals and toxicities in them. And the concern is that these are leaching out into the system, into the different tissues over time. And of course, the longer someone has implants placed, the more likely that this can occur. Types of heavy metals and toxins can be solvents and formaldehyde, silica, just to name a few. A second concept is a more recent identification is really related to bacteria or biofilms that can develop around the implants themselves. And so biofilms are made up of bacteria, yeast, particularly a bacteria called P. acnes has been found around the implants 6 times more in women who have breast implant illness symptoms compared to those who don't. So this has become a hot topic of concern because P. acnes has also been shown in individuals who have rheumatoid arthritis or thyroid disease. So this is an area of focus for as far as therapeutically, and removal of the implants could help eliminate this process. Third concept is related to chronic inflammation that can develop around the implant. This can take place perhaps because the implant is a foreign object and the immune system is acting as it normally would against something that doesn't technically belong there. And again, studies have looked at this and have shown 50% more chronic inflammation amongst women who have breast implant illness than women who do not. So this again may be a contention as to why some women who have breast implants may be ill versus others who may be fine. And then the fourth concept is something that I've been working with in identifying if silicone sensitivity becomes an issue. And so the immune system may be bothered by just the pure presence of silicone. And to remind you, silicone implants in general have silicone in the gel, in the cap and around the capsule, where saline implants have silicone around the capsule, yet saline inside. So both implants do have a silicone exposure, and so there's testing now that we can use to determine if someone has an immune reaction to silicone, and this is very useful because there may be other therapies that can be used once the implants are removed to help decrease the immune system's sensitivity to it. The next steps, if you think that BII is an issue for you, is to contact a surgeon, and not just any surgeon. We really need a breast surgeon who is well versed in working with women who have breast implant illness, because we really need the capsule around the implant to be removed, because this is where the bacteria are contained, the chronic inflammation, potential metals or chemicals from the implants. And so the intention of going into any surgeon with the understanding that they do an en bloc or capsulectomy is necessary. Second step after finding a surgeon is ideally meeting with a naturopathic doctor, as naturopathic physicians have a great tool belt for many other things that could be going on with the system at the same time. So breast implant illness may be the last thing that just shifted the body into dysfunction. So it may be really important to look at thyroid and adrenals and potential infections, heavy metals, food sensitivities. This would all be determined based on an intake with a naturopathic physician who can really make this an individual approach so that they can get to underlying health issues and kind of guide you properly. And then third, most importantly, if we've determined that breast implant illness is the issue and we want to have them removed, then immediately we want to get the diet cleaned up. And so to me, that means removing wheat and dairy, yeast, processed sugar of any kind, so that our bodies have an opportunity to better heal as these things work against the system. Sometimes our non-vegetarian patients like to be inspired by paleo or getting recipe ideas in that regard. Also, food sensitivity testing may be run by a naturopathic physician to really determine what foods we may be reactive to and therefore eliminate, so that we have a more individual approach. And while we're cleaning up the diet, usually working on gut health is paramount, because everyone's intestinal tract has good bacteria, hopefully, definitely pathogenic or bad bacteria, and then we have candida or yeast. And while we're taking out some of the sugars and processed foods so that we're not stimulating these negative organisms, it's also a great idea at this time to use some herbs to help eliminate some of these overgrown, again, organisms. And so berberine, caprylic acid, there are many, oregano, there are many different herbal combinations that I would suggest at this point in time. It's best to prepare for surgery as soon as we have identified when the surgery date is. And to me, a pre-operation recommendation would be taking in nutrients that are going to facilitate healing pre and post surgery. And so that means vitamin C, ascorbic acid or liposomal vitamin C, 1,000 milligrams 1 to 3 times a day. Really does depend upon the tolerance of our intestinal tract, as too much can cause loose stools. Zinc, 15 to 30 milligrams a day. Vitamin D is essential, and a probiotic. Those would be things I would definitely want my patients to be on prior to surgery. A day before surgery, arnica montana, which is a homeopathic remedy, 200C dosage, would be really an extra tool for healing. And ultimately, this can be taken the day before and day of surgery, and ideally 2 weeks to 3 weeks following, as it can help with bruising and healing and even pain management to some degree. I will say that with the nutrients that I suggest to take prior to surgery, it is best to eliminate those 72 hours before surgery, or follow the surgeon's instructions on what they feel comfortable, as we don't want to affect healing time, bleeding, or anesthesia. After surgery, we really want to reinstate those nutrients for the healing benefits that I mentioned for what we need to do pre-surgery. And again, I would wait 72 hours perhaps before starting, or whatever the surgeon that you're working with recommends. I also find it to be very useful to do hyperbaric oxygen therapy. And the reasons for this, and typically once someone heals a little bit more, maybe 2 weeks post-operation, 10 sessions of hyperbaric oxygen can be a game changer for someone who's just been through this. Not only can it help with healing from the surgery itself, but its ability to bring oxygen to all the tissues is of great value, because it really decreases bacteria growth, which we know is part of an issue with women who have breast implant illness. It's wonderful at decreasing chronic inflammation, and so those 3 reasons would be why we want to use a hyperbaric oxygen chamber. And ultimately, what this is having a patient enter into the chamber itself, where it becomes pressurized, and then oxygen is delivered through different, either nasal cannula or mask, and for an hour you can relax or read and do whatever you want to do during that session. But again, 10 of those therapies, either with 5 1 week, 5 the second week, or split up 2 or 3 times a week to get those in, would be wonderful. Detox is extremely important post-explant. We do want to wait enough time for the body to heal, and for some it's 6 weeks, for some it's 8 weeks. But then it's important to eliminate some of the toxins that inadvertently we've been exposed to during the presence of the implants. And so first, of most importance, when we're doing any kind of detox work, we need to make sure that we're having regular bowel movements. And so again, that means if we're not back on track with our diet, that's absolutely necessary. If we're still constipated, again, maybe seeing a naturopathic doctor and doing some food sensitivity testing, or exploring why the bowels are functioning the way that they should. The reason for this is if we're provoking any kind of detox reaction or response, and we're trying to get the body to eliminate these toxins, one way they are eliminated is through our bowel movements. And if we're constipated, then we're actually kind of injuring the system more by causing recirculation of that. So that's key. Second thing when we work on detox is we really want to make sure the liver and the kidneys and the lymph system are flowing so that we can facilitate release of this toxic burden. And so we usually use herbs to help with that. And so there are different formulas. One, for example, is a Pecana detox kit where we put drops in water to help with that. Next, we want to incorporate binders. So we have these toxins that we're trying to release, and then we want them to exit our system. And so to help with that, we suggest certain formulas that will encourage that binding to eliminate that. And so that could include charcoal or clays, humic or fulvic acid. And those are just some examples of chlorella, some really great nutrients. And the things that I'm suggesting, one or two of these binders, but those are some examples of that. And then next we need to include antioxidants, because when we have toxins, then we create a lot of free radicals. And so glutathione, particularly liposomal glutathione, NAC, vitamin C are just some examples of nutrients that we would want to also have on board during this 6 to 8 week detox cleanse. Some additional detox support during this time would also be of great value if one has the ability to use certain therapies. And one of the therapies I speak of is infrared sauna. And infrared sauna is a great tool as it helps release toxins in our fat cells and our tissues. And with the heat, it allows our body to sweat out metals, chemicals, solvents, mold during this process. And so again, if we have access to a sauna, I would highly suggest that during this 6 to 8 week cleanse, as well as it will facilitate more release. And ideally 3 sessions a week, for 12 to 18 sessions would be wonderful. And another added detox therapy that could be used is a detox foot bath. This is an excellent tool. Ultimately, it's where we place our feet in a water foot bath, and we have this electric current, a low-level electric current that takes place in the foot bath. And ultimately what happens is it cleaves the water charges into charged ions, and these charged ions act like magnets, and they help attract some of the metals and other toxins that our body can be burdened with. Some people think that when they are doing the actual foot bath, that the discoloration of the water means that the metals are coming out or the toxins are coming out at that time. But unfortunately that's false. Really it sets the tone of cascade release of different toxicities that tend to take place 3 days later. So we usually suggest doing detox foot baths maybe twice a week, at least 3 days in between. And again, that would be great if someone could do that for a 6-week period of time, or intermix a sauna with a detox foot bath. And again, these are additional supportive detox therapies that I highly suggest. Well, toxins can come from beyond the implants. They can come from our bones. When at any point in time, lead is unfortunately an ubiquitous toxin, heavy metal that can be in water, can be in paint, lead paint, which is no longer available. But the problem is, as a kid, someone who ate a China painted toy then absorbed that lead, and it adheres more to the bone. And so then we have this timeline where lead can slowly start to leach out into the system, and then mercuries and silver fillings in our mouth, and so that can accumulate over time. And then you walk into a building and you have carpet and paint, which have another level of toxins. They're called solvents, formaldehyde and tables. And so we're inundated all of the time with these toxins in our system. And then they like to travel to our fat cells. And so they store there, and some can be released a little bit more easily than others. If you're not feeling well after detox, part of that could be that it takes time. I have some patients where it can take, right after explant, they already see a set of symptoms that they had dissipate. For some women, it's 3 months after that. For some women, it's 6 months after that. And really, once we get to a point where we stop seeing this evolution of improvement, more things need to be looked at. And so in that instance, again, if we haven't met with a naturopathic doctor, I highly suggest it, because perhaps there are other things that are going on that are being missed. And so it would be important for them to do a thorough workup. Secondly, it could be that the body is in this cell danger space or phase. And what that is an interesting philosophy that shows that once the trigger or object in this case is removed, the body is still in this shocked state of protection, and it hasn't picked up that the foreign object is no longer there, and in which we at our clinic use many therapies to help kind of undo this trauma that may still be in place. And one of the therapies that we like to use is called FSM, or frequency specific microcurrent. Ultimately, they're low level of electrical impulses that we can program to try to get the body back in the right space again. And so we may use currents that deal with detoxing still, as that may continue to be an issue, or syncing the brain from this trauma that and physically has taken place, as usually the time when we have patients who have determined that breast implant illness is an issue. It could be 10, 20 years where they have suffered seeing multiple physicians and not getting answers. And so not only has this been physically burdensome for them, but it has also been emotionally taxing for them. And so there are many ways in which we can use this FSM tool to help kind of resync the body and allow it to understand, if you will, that the harm is really no longer there. Another tool that can be used also, if someone hasn't done a hyperbaric chamber initially, this may be something that would help kind of oxygenate the cells so they can communicate better once again. And then sometimes we suggest doing a brain map and looking at if the brain's connection is thrown off by the trauma of what's taken place, and neurofeedback may follow that. I would like to say that the road, as I mentioned earlier, for women who have breast implant illness can feel long and burdensome, but I can say I do feel such admiration and inspired by all the women that I've worked with to really press and determine what is going on with them. So I do feel, and through their journeys, have seen such improvements. I hope that this information is a starting tool for patients who are questioning whether they really have breast implant illness, or struggling post-explant and not getting to where they thought they would. And I feel strongly that the doctors at East Valley ND can help these patients on their journey, and that we can offer all the tools that are necessary.